walked over to the booth today, I saw a little smile on your face.
Yeah.
And I mean, this is the home turn right now. So what do the numbers look like? I saw the engagement's crazy. The floor's busy as heck.
We're not going to get final numbers until final audit is done, but we are way over 10,000 people, which is the historical numbers before the pandemic. So we are extremely pleased and excited because we achieved the academic objectives, but attendance is important, and you can see the energy and the excitement on the floor, as they call it.
Listen, the dynamics on the floor were tremendous. The presentations, the data, the main floor. I mean, the
innovation,
the innovation, the multimedia, all of that is showing extraordinarily well, and the attendance at every single one of the talks is packed.
And it's balanced, yeah.
Yeah, and the curriculum is balanced. What I did notice too were a lot of startups here, excited. I mean, and I see that because that's my vibe. Excited and really active on the floor as startups, trying to have the conversations, talk to the people. A lot of the people who left the strategics went to the startups. So it's really good to see that mix again here this year.
That's great. It's actually great because, as you can see, innovation is a big part of what we do. We have a dedicated innovation track. I don't think there is a meeting that has 4 days full of innovation. I mean, if you go now, you're going to see all the structural innovation. You can see the latest and greatest in every single field. So we're truly committed to that.
Yeah, and you and I discussed in yesterday's session where we're starting to see that digital influence come into the category, whether it's clinical trials, whether it's data analytics, whether eventually it's some advisement, whether it's on the imaging side. So it's going to be interesting to see how TCT continues to be leading from the front on how do we put more weight on that moving forward.
Completely agree with you. And we started to see, as you're saying, all this digital health growth and infiltration into the meeting. I think we spoke about this before, but I think it was easily 25% of all submissions that we got were related to digital health technologies.
Wow, that many.
Yeah, it was amazing. It's unbelievable. Now, one of the issues is that some of these concepts are still ahead of their time and not necessarily easy to explain or put in front of the audience, but it's happening. It is happening, and happening actually faster than I thought.
Yeah, well look, it's got to happen, and it's hard to explain because there are so many different categories within that digital, but it always happens on the fringe, right? And we're sitting next to us, Edwards, over there's J&J, over there's Abbott, over there's Medtronic. They're the ones who eventually are going to help incorporate and expand that, but they won't create it.
Exactly.
And so one of the good things about TCT is it brings those fringe technologies into the mainstream eventually.
Exactly. And a lot of these technologies and technological areas, what is interesting is that it's not problem-specific solving stuff. It's actually more about process, and it's more about efficiencies. So it is interesting because now we're seeing more innovation that is related to make the innovation process more efficient, to move faster, and to do different things that we never imagined before that we could do.
It's funny you bring that up because I had a conversation previously with a group I'm advising, and I'm wondering because right now one of digital's biggest challenges is how do I get paid?
Monetization.
Right, how do I get paid? Who pays for this? Where's the reimbursement? And the answer right now is there's no reimbursement. We don't know how you get paid, but you can do the procedure faster, you can do it more accurate, you can get higher advisement, but because of the construct today, I still need to know who's going to pay for this.
Look, there is one thing that never worked for medical devices. On the startup world, when somebody showed up to raise money with the selling point of I'm going to save money to the system, it never worked in medical devices. People didn't like that argument, but on digital, does work. because it's all about that. Just an example, I don't know how often do you use ChatGPT.
Sure.
It took me 3 months to convince myself that I need to pay a subscription to upgrade the ChatGPT power, because I find it so useful at many different levels that the monetization part I don't think is going to be a problem for them, because people will pay for something that is going to save them time. So I really think it's interesting, because what didn't work for medical devices may work for digital healthcare.
Yeah, as long as, to your point, we can figure out where's that money going to come from, because the hospitals are still struggling.
Exactly.
Reimbursement is still out on that.
Look, I'm going to say, something that I know many people may not like, but if we can use all these technologies to improve the efficiency and improve the quality of healthcare, even if it's at expenses of a percentage of jobs, I think it's okay, because that redistribution will happen in different areas, and maybe we're going to hire more people in any other different areas. So, as I said, at the opening, is we should not really be concerned about digital healthcare taking some of the functions that we have, if the end result is a better system for everybody. So I really think this is going to happen. It's unavoidable. Look, if you have a system that can read automatically echoes, and you're not going to have the bitching and moaning of echocardiographers because they need to, it's going to be a no-brainer. Let's embrace it. It's going to happen. But hopefully that money will help the system to provide better care of patients. And I think the net result is positive.
Great. Well, Juan, congratulations on a great TCT 2024, you and the CRF team. It's a privilege to be able to be here with you on the floor and spread the word.
Thank you for the invitation and the partnership, and looking forward to see you in the future in all our meetings.
Excellent. Thank you, my friend. I'm Joe Mullings. That's a wrap for TCT 2024. Be well.